one of the things we didn't speak about is, why did you decide to go public? The foundation I'll come to, but you didn't confine to sharing your story to your mother and father and your therapist. You actually took it out to the country, to the world, and that could not have been easy. And I remember one of the things you said was that if I can change even one life, this was worth it.
Yeah.
But you must have wrestled with that choice at some point. Do I keep it within the home? Do I take it public? And I bring it back to the fact that you live in the public gaze, which makes your going public with it a different narrative than from, if she went public with it. So what made you say, not just am I going to get better, I'm going to tell this story to everybody who cares to listen to it?
I think it was at multiple levels, Barkha. I think one, like I said, after having been through what I did, if I could share my story and if anyone in the world heard me and identified with what I went through and could come out of it or understand, and, if I could make a difference to at least one life, I felt at that point I'd, all of, going public, speaking about it would be justified. I also felt like the narrative around mental health in India needed to change. And I can do that today, the very reason why we're sitting here today. Because I felt like when I hadn't, and like I said, I was also working at that point, I was like, why can I not tell someone when someone asks me how am I doing? Like the film that you just saw before we came in is, I think what got to me was when people were asking me how are you doing? And one day I thought, are they really asking me how I'm doing? Do they actually have the time to listen if I said I'm not feeling okay? Will they actually give me that moment and understand what I'm going through? Or
is it just perfunctory?
Is it just superficial? Yeah. When we ask people, how are you doing? Is it just superficial? Is it just, formality because that's the way we've been brought up? Like just ask and, yeah, I'm fine. Oh, great. Everything's great. Is everything really okay? And I wasn't okay. So I think that's what really got to me because I wasn't okay. And it reached a stage where I was like, why can't I just tell people that I'm not okay? It was just that. And that's when I reached out, and that's when I felt like I needed to talk about it. I felt like, because I felt bottled, I felt caged, I felt like I needed to fly or swim or just not be boxed and to feel free, and I feel so free today.
Fantastic.
Thank you.
It is, you underplay, I think, the courage that you have shown. You have shown extraordinary courage. I've said that to you a million times. I will say it a million times more. Why the foundation?
Because I felt like just talking about it, I want to help people. I want them to understand what they are going through. We want to create awareness. We want to tell people that it's okay to feel the way you do if you're feeling a certain way. It's absolutely all right. So to create the awareness, to reduce the stigma, which is going to take us many, many years. Having said that, I think in just the last 2 years, I feel like the conversation is really shifted. Is it going to happen soon? Maybe not. But are we moving in the right direction? Most definitely. So to create the awareness, to reduce the stigma, to go into schools and colleges and educate teachers, educate students, educate parents that there is something like this that exists. It's there, it's happening all around us, and do something about it before it's too late. Suicide, depression is the next big epidemic to hit the world, if it isn't already. Yeah. And reach out to corporates, reach out to the corporate world. Tell them that it's so important in your workplace to identify what you're going through because the pressures are so high, to identify the people that you work with, to help them if you see sort of any symptoms. I think basically just to create the awareness, and hopefully one day, we also want to be the happiest country in the world. We don't want to be the most depressed. We don't want to be the country with the highest suicide rate in the world.
So workplace, I mean, we are at the India Economic Summit at the World Economic Forum. It is a question for workplaces. We are entitled to medical leave, but I don't know that workplaces offer medical leave for depression.
No.
Yeah, this discrimination is part of the stigma again.
You'd call it discrimination?
I think so. There's no other word, that I can use for it. Look, at the end of the day, there's no economic wellness without mental wellness. That's the core of any economic summit, is that we're in a cognitive era. It's not the building of a company that has real value, it's the cognitive skills of their employers. And ultimately, you can't perform if you're not well. So any company that's sort of short-sighted and doesn't offer leave or for mental health, or doesn't offer insurance for mental health, I think it's shooting itself in the foot.
Yeah.
So the World Economic Forum has actually developed a toolkit for businesses focused on depression. They've actually done pilot studies at a number of companies around the world. So if anybody here is interested, any corporates here in the audience are interested, that would be a useful resource.
What would you
as well.
advise people in charge at workspaces? What does the foundation, Deepika, for example, encourage? What do you say to an employer? Let's say there's an employer in this room and she or he want to know, my colleague comes to me and she says, I'm depressed.
Right.
What should be my professional yet empathetic response at the workspace?
So to the individual, or are you talking about at a corporate
As
policy
a policy,
level?
but I'm just taking an individual example. But what would you advise on policy?
Well, at policy level, first of all, I think public-private partnerships are going to be very key, so they could partner with a foundation. There are plenty of foundations. There's Banyan, there is Spark, there is Deepika's foundation. I think education is going to be very important, setting in policies that are anti-discriminatory against people with mental illnesses, encouraging employees to volunteer, because volunteering itself builds resilience against future mental illnesses, making available resources for people to get care and accurate diagnosis and treatment, giving appropriate vacation, and making sure when they come back from the treatment of their illness that their career trajectory is not shifted and derailed.
So let me just be the cynic here and say that when you talk about public-private partnership, is one thing for foundations like Deepika's and others to join hands with the private sector. But when you talk about people who don't have resources, who don't have money, the
like
poor.
Small businesses? You mean?
No,
Okay.
rural India
Rural
or poor people. If you take a trip to the All India Medical Institute, you have people waiting out in line whose children are dying of cancer and they cannot get time with the oncologist because the public health system is so strained.
I'll make a comment.
Can we convince the government of India to actually turn the public health system towards depression, given the social stigmas, given the overstretched nature, given the absence of resources?
Yes.
And Deepika will also comment, but I'll give you 3 examples. In the US, about 10 years ago, the FCC, which is the Federal Communications Communication, introduced a new Lifeline Act, which made sure that smartphones were available to every poor person in the US to call. The city of Birmingham and London created a public-private partnership with about 20 companies, raised $125 million, started a 24/7 hotline for college students and high school students to call in on mental health issues. They also started a special college where people who have mental health and drop out of colleges can catch up with their curriculum and go back to the original college. New York City has started a $30 million public-private partnership to take care of mental health amongst the homeless and amongst the poor. So yes, it's entirely possible. There are hundreds of corporates here who would be glad to support such an endeavor, but maybe you want to add to that.
No, I think similarly, I think it's important for people at workplaces, policymakers to sort of, like we were talking about leave, if I'm diabetic, if I have a surgery, if I'm pregnant, if I'm X, Y, and Z, you will be allowed medical leave. Whereas if you go to your boss and say, I have depression, he's more likely to say, I'm going to have to sack you.
Yeah.
We need to normalize that. We need to treat it like anything else. I think a large part of the stigma, or a large part of, even if there's people who want to come out and seek help, you need to confide in your boss, or you need to confide. I think there's the fear of losing your job.
Look at your own life. If you had gone to a film producer and said, I can't do this film right now or because I'm depressed, what do you think would have the response would have been?
Maybe there are people who haven't offered me films because they think I'm depressed and I can't act. I don't know.
You think that's
I
happened?
doubt it.
Maybe. I don't know. It has.
And did that make you ever regret going public?
I'm in a good space because I can choose the movies.
No, I know.
I want to do.
I know.
But I don't think everyone has that luxury of choosing where they want to work, when they want to work. So it's important for the organizations to understand that we need to treat this the same way as anything else. I think it's equally important to have frequent sessions in your corporate offices about the importance of mental health. I think it's important to have a tie-up with a counselor, or maybe have an in-house counselor, or maybe not a psychiatrist, but it's important to have an in-house counselor when your staff is burnt out, they need to talk, they want to speak to someone, somebody's there, or at least make them aware that they should. And I feel today it's important to just seek help of a counselor anyway, because our lives are so fast-paced with technology, with so much going on in the world. I don't think there's any harm in just seeing a counselor anyway, because...
Did you continue to see a counselor even after you got better?
Yeah, on and off.
Whenever you needed to.
I know a lot of my friends who've never experienced anxiety or depression, but it's very important for them to see a counselor, to see their counselor every now and then. A lot of people do. And we need to normalize that as well. A lot of people say, I have a meeting. You lie about it. I'm in the middle of something, I'll call you back. Or just lie and say I went to a general practitioner. We need to normalize it. It has to be as normal as anything else.
So I'm going to open this up. I don't know how we're doing on time, actually, if somebody can tell me, but we've got 10 minutes. The cultural dimension, doctor, because this therapist thing reminded me that, a friend of mine recently said to somebody who said, I've got a meeting with my nutritionist at 1 and my counselor at 2, that you're really living the American life. Now, this was right. But there is a cultural dimension to it. Like in India, we think of these things incorrectly as these Western imports into our country. So I want you to speak briefly on that. And actually, I'm seeing Anna Chandy here, who's actually Deepika's counselor. So I want to bring her into the conversation.
Sure.
But just on that thing of the cultural dimension.
Culture is very important, and all treatment and diagnosis has to be culture appropriate. There are many, many psychiatric disorders that would be viewed as abnormal in one culture that are normal in another culture. I'll give you an example, which is somewhat not pertinent here, but there's a condition called Williams syndrome, where people are born with this genetic condition. They don't discriminate at all. They treat individuals of all races as equal. Of course, in countries where there's a lot of racial discrimination, that would be seen as a good thing. In America, for example, people see people with Williams syndrome as something very great. In other countries where there's sharp class distinctions, people see Williams syndrome kids as very abnormal.
So apply that to depression.
So depression has to be treated in a cultural context. You cannot treat depression outside of the culture. You have to diagnose it.
But sometimes you have to push the boundaries of what is culture appropriate as well, right? It was not part of Indian urban culture even 20 years ago to go and see a therapist.
Right.
But today there is a greater acceptance. So culture is not static either.
Sure. But that's not to say that American or Western psychotherapy is the only solution. There's a variety of Indian and hybrid techniques that are very important if someone believes in the Bhagavad Gita. People may not realize Bhagavad Gita was the original psychotherapy session, the crisis psychotherapy session, right? So yoga, meditation, all of those are very powerful. I think it's a misconception that you have to go with the Western psychotherapy. We've done studies, others have done studies that yoga is just as effective. And there's a variety of other techniques as well.
It's an entire lifestyle change, if I may say. My life, literally pre and post, my life post-depression is very, very different from my life before.
What's the biggest difference?
I take care of myself. and I don't feel guilty about
But
it.
didn't you always, like as an actor, take care of yourself? Or do you mean beyond physically taking care of yourself?
It's absolutely not in terms
Related
of
to-
physical appearance, but it's important to, and especially with women in India, I feel that there's a lot of guilt
Yeah.
attached with taking care of yourself and doing things for yourself, because we're constantly playing roles and constantly doing things for other people. And the minute you take that 1 hour off because you want to go and see your friends for lunch,
Yeah.
there's suddenly so much guilt. It's totally okay to do something for yourself, a little bit of some, of me time, whether it's going to getting frequent massages, whether it's sleeping, adequate sleep, eating well, just taking care of yourself in a holistic, in a holistic way, not just medication like we talk about, is just one of the things that's the approach I took.
Yeah.
Maybe
And
it'll be different for.
We want to emphasize that no one's dissing medication. Medication can be life-saving for some individuals.
Yeah.
So I want to make sure
Yes.
that it doesn't work for everyone.
Okay, I need to go into the audience. We have 5-7 minutes. Anna, why don't we start with you? If you just want to speak, start taking Deepika's experience with you as a starting point, but what you'd like to say to the people here, especially parents. I think for parents, for families, what should they be looking out for?
I think in India, particularly with the experience of the foundation, adolescent children, a lot of the symptoms, obvious symptoms, show up in depression, early stages of depression, as behavioral. And therefore, parents and teachers need to have awareness and education that some of the behavioral symptoms, if, again, as Dr. Doraiswamy said, if they are clustered with other symptoms, and they are existing over 2 to 3 weeks, then we need to look deeper into it. For example, it was with deep sorrow that last year, a young boy in Bangalore was expelled from an international school. All that he complained was headaches. So he was 17 years old. He would put his head on the desk. And they expelled him saying misbehavior. So Dr. Butt and myself actually called the school after the diagnosis and said he's got depression. And so can you take him back? And they said, we don't want to deal with mental health issues. Today, the young boy has joined University of Chicago for his undergraduate program. So the discrimination and excluding young children, under the guise of laziness, because sometimes there is apathy, laziness, or labeling them, I think.
Or not wanting to take the responsibility. Like I can imagine the school calculating, if this boy does something to himself, we don't want that responsibility.
Absolutely.
No one wants to take that responsibility.
We've had a lot of pushback from schools as well.
Yeah.
When we've wanted to, take our schools program. A lot of schools, I have to say, were very, very open to the idea. And in fact, we've covered, I think, more than 300 schools in the last 1 year. But it's surprising that a lot of schools don't
Resist
encourage.
it.
Yes.
They
It'll
resist.
change.
And the other thing which I'd like to, in continuation with what you said, I think India is a context and we're a collective society. So even when we look at mental health issues, I think we need to look at it from a collective thought. For example, for me as a practitioner, in my private practice, I insist on a systemic view of the issue. Because the individual is suffering, they can't manage this on their own. So the system or the collective, the family need to be part of that process. So what I do is the individual becomes, to me, the voice of what's happening. And the other members also come in for therapy because they also have their own issues. And I think this is very, very important in India. While I'm not disputing that, Western approaches are important, but we also need to remember a lot of the Western approaches are individualistic. I see that huge difference in terms of context. We do one more question, which you need to understand. In the rural area, there are mental health workers that include the soothsayers, the witchcraft people, the astrologers as part of the education program. And one of the programs that we run in North Karnataka, we have actually funding a program in the rural area where the local people become part of the counseling process.
Yeah, you have to get the quacks out of the system as well while being open to alternative modes. Question there? Yes.
Yeah. Hi, I don't know if I missed, I came in a bit late. Ms. Padukone, you had everything going for you. You're good looking, you were rich, everything. So tell me.
Don't say,
what
why
is-
are you depressed?
I'm asking this
Then our 1 hour conversation has been absolutely useless.
Can
An hour.
depression come to anybody for no reason? Because somebody who has everything going for her, why should she get depressed? I'm asking this not from a personal point of view, because I know of some people or somebody that is going through depression, and I'm not able to figure out what's the reason.
Right.
So
I
I'm
think Dr.
asking you,
Murli would be the right person to answer that question.
But can I just preface here, because you did come in late, ma'am, and one of the things we did discuss was that this is the response that actually hems people in, that you've got everything, why are you depressed?
Well, nobody wants to be depressed, right? So it's not like you're wishing it on yourself to be depressed. So we don't fully understand the biological roots, but there are biological triggers. Could be partly genetic, partly a mix of some psychological, social, and biochemical factors. If there was a way that I could have scanned, her brain at the time that you were feeling empty, sad, maybe we would have seen some changes in biochemical circuits, etc. But at this point in time, we don't fully understand it at that level of cellular circuitry alteration. All we know is that there's a combination. Some people, it's an obvious response to triggers. So, for example, you just tell someone, I don't love you, and you spiral into a downward spiral of depression. That's an external trigger.
Yeah.
In others, it just comes out of nothing. They're doing fine,
Seemingly
and all
nothing.
of a sudden,
Yeah.
it
Seemingly
just comes
nothing.
in there.
Okay.
Seemingly nothing.
I'm going to take here in the front row. Are we out of time? Okay. Just last comment, yeah.
Sure. In option B, Sheryl Sandberg and Adam Grant talk about two phrases. I know exactly how you feel, and let me know if I can do something for you.
Mm-hmm.
When you hear these two phrases, do you feel comforted or do you feel a cognitive overload? Because research shows... Do you feel comforted that you've been understood, or do you feel that you have to tell other people how they can help you?
It's a bit of a confusing question, yeah.
Do I feel comforted when somebody asks me?
So in the book, they say that one shouldn't actually say, I know exactly how you feel.
Oh, okay. All right, got it.
That's true.
So do you feel people got you with empathy, or do you feel like they're patronizing you? Like they don't exactly know how
I can
you feel?
tell the difference. I can look into their eyes and know. You can tell. You can tell when someone's genuinely reaching out because they know, either they understand, they're empathetic, and they know genuinely what I've probably gone through, or they know someone who's been through the similar experience. And then there are the ones who are
just faking it. All right, I'm afraid we do have to close it there. I'm getting the signal that we do have to wrap. I think it is fair to say that Deepika's public accounting or chronicling of her own story is not just brave, but it has a purpose to it. Let's just say that the foundation, the telling of the story is a purpose, that the next time somebody says to you that they are depressed, please treat them with the respect that sentiment, that ailment, it is an ailment. And it is treatable to some degree, preventable to some degree, like any other physical ailment. And that would perhaps be the biggest service we can do to people like Deepika and Dr. Duraiswamy who work in this area. Let's have a round of applause for our guests today. Thank you very much.
And to you for brilliant moderation.
Thank you.
no doubt about that.